Hello, welcome back to Red Pill, Blue Pill. I'm Emily Reinhardt, student physical therapist with College of St. Mary's in Omaha, Nebraska. If you've been following along, we've covered topics about the opioid crisis and a bit about how we got here. As a reminder of what I said in my very first video, please do not discontinue any medications without being under the care and supervision of a physician. As we learned, opioids can be very addictive. This also means that there can be some severe side effects if they are suddenly discontinued. In today's episode, we're going to discuss a bit about how pain is managed in the modern-day healthcare system in the United States. We've discussed what pain is, but what about treating it? Well, one of the first steps anyone takes is going to visit their primary healthcare provider, or even going to the emergency room. We're going to focus more on the primary care provider in this video. When you see your doctor or provider, a quality exam should include evaluating several systems to work out some of the root causes of any pain you're experiencing. These systems that should be included involve the nervous system and the musculoskeletal system. A psychological assessment is also warranted, and in many cases, blood work may also be ordered to rule out any pathological diseases that may be contributing. There may also be imaging ordered to make sure that there's anything of structural concern, like perhaps a broken bone. This should be an extremely extensive exam that takes time if it's checking all of these systems. But unfortunately, multiple studies have found that individuals spend less than 20 minutes of one-on-one time with their provider. There's hardly enough time to really get to the root cause and to talk about it. The physicians and providers will quickly try to categorize complaints of pain into one of three types: nociceptive, neuropathic, or pain of unknown origin. I'll break these down for you. Nociceptive pain is pain that is generated by a signal from specific nerves, called nociceptors, that sense when something has gone wrong or might go wrong. When a bone is broken, or that initial pain that happens when you touch something hot and jerk your hand away so it doesn't get worse by staying longer. Neuropathic pain is pain that's due to disruption in your nervous system. It occurs when there's a disease or what we might call a lesion that's affecting nerve fibers and the signals they send. Diseases like diabetes and multiple sclerosis, MS, that impact the nervous system can have neuropathic pain. Pain of unknown origin? Well, that's exactly what it sounds like. Chronic pain conditions, or pain that doesn't fit neatly into the other two categories, falls into this one. Once a physician feels like your pain has been categorized, they will frequently prescribe a pharmacological option. Pharmacological options, though, rarely treat the cause of the pain and only treat the symptoms. Oftentimes, this is where the visit ends, and in many cases, other options for pain management aren't always pursued. Options like physical therapy can and are highly effective for treating chronic pain and have consistently better results than pharmacological options. Physical therapy has the ability to thoroughly provide the time and attention to look at each system and how they're interacting with each other in order to effectively treat chronic pain and the impact that that's having on an individual's life. Additionally, psychological approaches, yoga, and evaluating diet and sleep health can be instrumental in treating pain conditions. Some providers also lack understanding of different non-pharmacological approaches to pain management and may therefore not prescribe these options. This is just a very small glimpse into the world of how healthcare systems manage pain. Limited time with patients limits the options that might be provided to patients, or just simply poor physician and provider education. They may not know. It's important that when you meet with your primary care provider, you discuss all available options that do not include a pharmacological approach to treatment. Again, this is a brief insight into how pain is managed in the healthcare systems in the United States. Up next, we're going to discuss how PTs evaluate and also treat chronic pain conditions and what they can offer you.